Now we have persons, noi abbiamo tre persone che abbiamo chiesto di
have three people that we asked to join us to have a comment. We have Carlo Favaretti, we have Nicola De Andrea, and then Franco Perraro, who's jotting down notes because he's a courageous person, and notwithstanding his Parkinson's disease, he wants to tell us something. I wanted to ask specific questions of our colleagues concerning these 8 presentations, and thanks to the colleagues that were patient enough as to stick to the meeting and stay with us up to the end. Franco has managed hospital management for 20 years, and you always did so focusing on quality, and you're the president of the Technology Assessment Society. To what extent do you agree, and to what extent don't you agree with what has been said? Well, yes, thank you. If I may, I would like to share with you my own memories. I met Professor Perraro, if I'm not wrong, back in the year 1987. And he was, to me, a source of inspiration when I was the CEO of Padua University. And then I worked for many years, plus 16 days, as a CEO of hospitals. So I fully agree with what has been said in practice. I would simply like to point out one thing in my own respect. Successful experiences are those experiences where you have a combination between a top-down and a bottom-up approach. Without a systems approach, which must be shaped by those who have a formal responsibility for that, without that sort of approach, you can't do anything. In the end, you simply try to do something, but you can't actually do it. So the professionals must have this taste of continuously improving the quality of our work. The top-down approach, in the end, otherwise, is simply bureaucratic and only formal, and it won't work. So these two approaches must be taken together, must be followed together, and that way you can really tackle the problem of quality with a systems approach. I think I may say so. Based on my experience, I brought 2 larger hospitals to the Joint Commission accreditation. I accompanied 1 regional hospital, as Trento's hospital, to the first recognition and then to the confirmation of the ISQUa recognition. And there is Professor Diana here, who was my boss in Padua. And I would like to recall that back in 1991, during the ISQUa conference in Washington, we submitted a presentation on Padua experience, which was to be a systemic experience, quality improvement systems in the hospital of Padua. And this was published by the ISQUa journal too. So you have to mix together in the right way this top-down and this bottom-up approach. There is an old physician who was a pediatrics chief physician. Are we completely mad? My question is, are we just thinking freely here, or are we saying something wise? Maybe we are continuing to dream. We are still dreaming. But I think that the contributions offered this morning were very precise, very accurate in tackling issues that we have been thinking of for years. We have done perhaps very little. Since you mentioned me as a pediatrician, you said that I was a pediatrician, you will possibly remember that some 25 or 30 years ago, papers had already been published which suggested that we could do more with less, or we could do better with less. And the Society of Pediatrics actually had said that already some time ago with a very committed sort of spirit. So we can continue to do things. And the Gino Tosolini Association intends indeed to focus on good practices in healthcare. It's a more modest title than the things we've been saying this morning. But our objective is just that. We want to promote. We will have an assembly in the Kugli room. And thank you for hosting us. Thank you for being here. Maybe we still have some time for a few qualities love in the end. Let's see whether Franco wants to tell us something. Well, I do want to tell you something. And I have loads of courage myself, because you possibly heard that I have Parkinson's disease. Yes, I have Parkinson's disease, and I'm approaching the end of that stage in Parkinson's disease. Unfortunately, I have serious disorders. I can walk with 4 legs. 2 are mine and 2 are just 2 sticks. Anyway, I'm really excited. I'm carried away with enthusiasm, having heard what was said yesterday and what was said this morning. Yesterday, meetings at a different level. Here today, we have an audience that is completely different from the one we had yesterday, and which can be extremely useful to us in the future. I think it is extremely important to focus on the leadership. If you have no leadership involved in this, you can't do anything. A chief physician in a hospital needs to work for his or her specialty. And that attempt, when he or she tries to do something, well, that attempt perhaps can't be as successful as we would like it to be. But I'm not going to deliver a speech. I'm not going to offer a presentation. I would simply like to have a chat with you as if we were sitting at a table at a restaurant. By the way, we have an appointment for quality also in that respect. Unfortunately, the mic doesn't seem to be working. Okay. No, okay, it's okay. How did we evolve? We've come to an important stage of development of quality. We knew nothing about quality at that time. Or we knew what just any ordinary person might know about it. If a woman goes to a shop and wants to buy a dress, she will pick the one she likes best. That's her quality criteria. But here we are in a different situation. We would like to be lucky enough to be able to develop quality in all of our meetings. And so, let's talk about our approach to quality again. I worked in the field of emergency medicine, and I worked in emergency departments in different hospitals and in the 999 service to focus on concrete needs, concrete objectives. You must work concretely when you deal with that problem. You can't make mistakes. The quality objectives in our own case are of paramount importance. And we need to involve all of the different professionals working in a hospital and also within the community. This involvement was achieved as follows. I was a member of the European Association of Hospital Physicians. And we had participated, Rosa and myself had taken part in a European meeting. We didn't know each other at the time. And she convinced many of the physicians who were there that she would organize with a specific center for hospital healthcare. She said she would organize a meeting in Utrecht, and we went there, and we started to exchange ideas and opinions, and we had drills, exercises together. There was me, there was Andrea Gardini, and another radiologist whose name we won't mention, an anonymous radiologist. And there was also Huori at the time. And this center organized this work group. I looked for support on the part of various hospitals in Italy. And Anu Huori asked me, who deals with quality? Who is interested in quality in Italy? And I said, well, I do not know. We came here just to listen to what they had to say. They said that they would talk about new things, new developments, and we were shocked. Anu Huori asked me, you are a representative of the WHO. Can you help us? We have a meeting of an international committee on quality. I didn't know anything about it. And Huori told me that I shouldn't worry. Rosa Sugnol, those very days, was starting a quality program. She was starting a quality program at the time, and she said, if you attend that meeting, you will learn important things. They will be very important to you because nobody knows about that. It was a particularly interesting meeting because at that time I started to understand and Vuori started to understand too. We started to understand something about these problems. And we sort of tried to introduce these innovative ideas into Udine's hospital with great difficulties because it takes leadership involvement to manage to solve these problems. And then there's the whole question of hospital-acquired infections. Together with a bunch of few people, with engineer Tosolini, we managed to organize this program that was quite successful because in Spain we were awarded the first prize, a first prize for quality problems. Obviously, we all agree. Being good at surgery, for example, is not enough. Being good at a specific procedure is not enough. You must have knowledge and you must know how to do things. You need to know theory and practice in a way. And SIMEU, collected data. It's a very important collection of data. The situation quality-wise in emergency departments and in hospitals was terrible in Italy at the time. And we managed to introduce and develop a set of programs that were particularly interesting. If you are to obtain something, if you wish to obtain something, you need to foster individual and collective activities. These are two different things, but you need them both. I tend to follow a bottom-up approach. Knowing how to do things is very important. I've already covered this point. A very last thing. You must move on gradually. One important thing that emerged from the legislation of other countries too is the following. Emergency physicians there is a new legislation concerning nurses. Nurses are very important. Other figures are also very important. Economists are very important. They know how to go about so many things, but I can't remember the name of an American economist who said these things. He said, however, that You can't develop programs based on the economy you have, because you run the risk of throwing money away without obtaining results. You should do things together. You should start from a very low level. And I was involved in some research that was extremely interesting. And now the most important thing, the most interesting thing is that I would like to convey to you my greetings, my personal greetings. And this afternoon, we will have to go back home. Unfortunately, when I got here, I saw that I had forgotten my spectacle at home and I wasn't able to read. And loads and loads of things have been said here. And we must focus on the needs we have in a specific activity within a specific organization. We can't tell things how to go about their activities if there isn't a plan behind it. We need to have a plan behind it. We need to have a leadership, which means being sensitive to the other people who work with you. And you must try and work for the population that needs to be protected. With that, I would like to convey my personal greetings to all of you, and I wish you a very pleasant lunch. So this day is over. Thank you, Franco, and thanks to all of you. A very last question. But please come here and have a photograph with us so that we can remember these beautiful moments we spent together. We have Hannu.
Well, it's sort of shame to speak after Franco and his wise words, but within ISQUa and within WHO in quality-related meetings, we have had a habit or custom to honor people who have contributed greatly to quality assurance by making them members of the Noble Order of Guardians of Light. That order was created actually in a WHO meeting in Barcelona in 1984, and since then quite a few people have received this honor. Franco was number 2 on the list. Anyway, so the Noble Order of the Guardians of the Light are people who have, as I said, contributed greatly to quality assurance. And the symbol of this order is this snowball with a candle inside. And originally, when quality assurance was a very new thing, the snowball symbolized the cold, hostile world within which the flame of quality assurance was supposed to be kept alive. Later on, when quality assurance sort of spread and gained more momentum, the symbolism changed. The snowball is the beginning of an avalanche that will cover eventually the entire healthcare system. Everybody will be involved in promoting, improving quality. Now, normally it was tried to get this flame burning. That was also always a little bit difficult, but let's see whether we succeed. So, I think that Andrea has very to say.